African Coalition Symposium on Menstrual Health, organized by the department in the Presidency Responsible for Women and UNFPA East and Southern Africa, is raising awareness in menstrual health. In 2018, on the International Menstrual Hygiene Day marked on the 28th and the 29th, call to action was made in an event held at the Hilton Hotel in Sandton, Johannesburg. The call identified emerging priorities in Africa and committed to further action led by an African Coalition for Menstrual Health Management. Now, to take this discussion further, we joined via Zoom by Dr. Renata Tallarico, who is the Regional Coordinator for Youth Team Lead and Safeguard Young People Program. A very good afternoon to you, Dr. Renata. Thank you so much for joining us. Welcome to SA Today.
Good afternoon. Thank you for having me.
Now, the UNFPA is currently hosting a symposium to address menstrual health this week. Now, let's start at the beginning, Dr. Renata. What is menstrual health, and what's your understanding of how adversely it affects women, especially young girls, socially speaking?
Thank you. Indeed, let me just start from the real beginning, which is menstrual health is normal and is universal. And we also know that for half of the world population, menstruation currently happens, will happen, and used to happen. So it is really important to normalize the concept of menstrual health. And it's also very important to make sure that we don't limit menstruation to only a biological process, but we realize that there are more dimensions to it. It is a social issue, it is a public health issue, and it's a human rights issue. It's a matter of dignity. And it does need to be seen as something that requires collective effort. It's a multi-sectorial issue and is a life cycle matter, which means it's not just about puberty, but it's also about all ages, because it does affect all ages, from menarche to menopause.
You've made quite a valid point there when you said that it is actually a human rights issue. And having said that, what are some of the issues women across Africa face on a daily basis regarding menstrual health?
Let me share with you some evidence. What we know is that 1 in 10 girls do not go to school. They do miss school because of lack of access to menstrual products. We also know that in terms of absenteeism, 10 to 40% of absenteeism is due to either pain or lack of access to menstrual products. But what is really interesting, and here's where we bring another dimension, is that among the people who experience period poverty, 14.2% experience also severe to moderate cases of mental illnesses and depression specifically. In addition to issues related to stigma, for instance, secrecy, impurity, that sometimes come from the different societies and cultures, the way they foresee or perceive menstruation.
Now, how has COVID-19 affected raising awareness and exposed the most vulnerable in this regard?
Indeed, we have preliminary findings showing that COVID-19 has affected women and girls and people who menstruate in very many ways, limiting their ability to get the right information. And also we know that the socioeconomic fallout due to COVID-19 has very much affected women particularly, and therefore their ability to purchase sanitary products has been limited. So we do have a clear gendered dimension in the COVID-19 and how it has affected also the menstrual health of women, without forgetting that the large majority of the frontline workers are females, and therefore they have extra limitations when it comes to wearing PPE while menstruating.
So back to the symposium. It's been taking place, I do understand, from yesterday and will continue until tomorrow. What does the symposium aim to achieve? Put simply, what are some of the, what are some of the main topics that will be tackled?
Indeed, there are 3 mainstream that we are trying to kind of tackle, particularly. One, really appreciating the progress that has been made since 2018 with the first of its kind symposium on menstrual health that was co-hosted by the government of South Africa as well, but also to assess what are the gaps, what still needs to be done. We had great conversation with experts in the field related to research gaps that will help us mobilizing more resources. And today we discussed issues around integration of menstrual health in sexual reproductive health and rights policies and programs. And tomorrow we'll talk about sustainable financing, how we look into high impact practices that will allow us to really realize menstrual health for all in the continent.
And how can people across the continent access the symposium? I mean, is it open to the public?
Yes, it is. It's open to the public. At the moment, it's live streamed on the UNFPA ESARO, ESARO, YouTube and Facebook pages. So everybody can access it and view the outcome of the symposium.
All right, Dr. Renata, great chatting to you. Thank you so much for your time.
Thank you.
There was Dr. Renata Tallarico. She is the Regional Coordinator for Youth Team Lead and Safeguard Young People Program under the UNFPA. This is SA Today on SABC News. Let's take a quick break. We'll be back shortly.